If I were to say to you operational exercise Cygnus, would you know that's Cygnus with a C, not sickness? Would you know what I'm talking? Do you know what I'd be speaking?
Could you tell me what you're talking
This
about?
is not under your watch, not under your watch, but this is in 2016 when the Conservative government ran a pandemic trial or dummy run called Exercise Cygnus. Ministers then were warned 4 years ago that Britain would be overwhelmed amid a shortage of critical care beds, ventilators, more capacity, and here we go again, PPE or protective kits. The three-day dry run tested how hospitals and other services would cope. Whitehall officials deemed the findings too sensitive to be made public, and they remain classified. Not you personally, but a previous Conservative government knew this was coming and did nothing, didn't they?
I think that actually what you can see from that is that we are well prepared
No.
for a
Let's talk
pandemic.
about what happened. Not you personally. I know you weren't personally in government, but the Conservatives were. 4 years ago, they had a dummy run, a trial, a test. It was a disaster, and nothing was done by the Conservative government, was it?
But you've made a statement which I haven't heard anyone else say about that exercise.
What have you heard about it? It was a glowing
thing,
success, was it, Minister?
Well, I will, if you'll give me a minute to speak. So the important thing is that we run pandemic flu exercises. That, for instance, in every area where you have a local resilience forum, they all had pandemic flu plans, which means that to be ready to cope with coronavirus, it's been a matter of updating those plans for the specifics that we know about coronavirus, rather than starting from scratch, which has put us in a good place. On the things like the NHS capacity and the number of
I'm so sorry, I have to
ventilators,
challenge you there. You think we're in a good place?
So we are much better prepared than many other countries around the world because of the preparations that had already been made and the exercises that have been carried out. Can I just come to your point about the ventilators and the NHS capacity? So at the moment, the NHS has 8,000 ventilators, 8,000 more coming online shortly, and thousands more to be produced thanks to fantastic response to the call for manufacturers to support it. Hand in hand with all the work that's going on is about, on the one hand, increasing the NHS capacity to look after people who are sick, and while together with the guidance to stay at home and on social distancing so that we reduce the spread of the virus and enable the NHS to cope with the number of people who will need its care. And this is a huge national effort, really important. Everyone can play their part, whether it's staying from home, working from home when you can, or those fantastic doctors, nurses and social care workers who are at the front line.
Yes, but they spent 3 days going through this exercise, which showed holes all over the place, and nothing, not by USA again, and nothing was done by the Conservative government. Instead, the austerity continued. How do you defend that, Minister?
It's not clear at all to me where you're getting your information from. And
I'm staggered that you're the Care Minister and your staff didn't. This was the front page of yesterday's Sunday Telegraph. I am staggered. I don't know how many people you have working in your department that no one told the Care Minister. How do you feel that the journalists know about it and the Care Minister doesn't, Minister? How do you feel?
So you're making statements about something.
Why don't you go read the article?
About information that's not even in the public domain.
Hang on, the Sunday Telegraph. What are you talking about? It was available yesterday, Minister. I don't expect you necessarily to, but I don't know what your press team were doing if they didn't think to tell the Care Minister that Exercise Cygnus was an unmitigated disaster in the field of health and public care, and you didn't even know.
As you yourself said a minute ago, that those, not all the information from that particular exercise is in the public domain. But the important thing is that these exercises have been carried out. The important thing is, for instance, for the question about the supply of PPE, that we would not be able to distribute 170 million items of PPE around the country if we didn't have a huge stock ready for a pandemic of PPE in the first place. That puts us in a good position. I don't suggest for a moment it makes it easy. It's a huge logistical exercise, but it does mean, because exercise is being carried out, because we have pandemic flu stocks, because every area has a pandemic flu plan, it has put us in a place from which we can then build in order to make sure that we have a strongest possible response to coronavirus.